So I have to be calm at the first if I saw blood, so I don't panic. Stay calm so I can help the patient mentally. So I have to be patient. It's very important that I don't panic and be patient with the patient. And I have an experience about first aid as a knowledge. So let's begin. Okay, there's many guidelines people discuss about first aid, so I prefer this system. It's very easy to know. It's the triple C method. We're talking about a check and call and care. That's when, say that I was crossing the street and someone was hit by a car. So what should I do? At the first, we're gonna check the patient by using a method called doctor. D stands for danger and R for response. As if the patient was in the ground, so I have to make sure that he's safe, that another car wouldn't come to hit him or something. So I have to take him to a safe place so I can call the ambulance and start my care system. Number two is the response, is to see the patient if he's conscious or not. May he be semi-conscious and may be unconscious, or maybe conscious, fully conscious. So number two is the call of the ambulance. It differs from a country to another. So if anyone knows what's the number of the ambulance at Azerbaijan, you can write in the chat. Yes, it's 103, correct. And for IFMSA-Egypt students, it's 123. So let's go back. Here it is. 103 is the ambulance number. It differs the system of the ambulance from a country to another. As for Egypt, they take like 1 minute to it's automated, like hello to the ambulance and so on. So we call after seeing the patient on the ground, so I can go through the care system and return to the call. I don't know in Azerbaijan you have this automated system or not, but if there is a called automatic like welcome to the ambulance and so on, so I make the call at the beginning, then I go to the caring system and continue what I'm doing. Okay, so let's go to the care system. So it's A, B, C, D, and E. As for clinical students, there's something called G, at Glasgow Internal Medicine. It's very advanced, like giving the patient a number from 15 about being conscious and so on, but this is used in the emergency room, not in the first aid. So we'll begin with the airway. Just to make sure that the patient is breathing well and opening his airway, we use two methods. It's head, tilt, chin lift, the first one. As we see, I know it will be kind of difficult to discuss first aid as online. It's preferable to have mannequin and be physical, but we'll try to discuss it easily. So head tilted chin lift, that the patient will be laying on the ground in front of me. So I'll put my hand on his front of head, then the other hand will be on the chin as you see the video, and I push the front to the back and open his mouth. That's the way that I use to open his airway. Again, I'll put my hand on his forehead and go it back, then my thumb at the chin and open his mouth. So that I open his airway if it's something constructing it or any obstructive method. But this case doesn't go well with all the patient, as the patient may be suspected for spinal injury. So I can't move his head, that he can be dead. So we use another method called jaw thrust. The other one here on the right, as you see, the patient hand cover his all head, and my three fingers at the jaw thrust here, the jaw of the mandible. So I open it by fixing the neck, not moving his neck. So my hand is all over his head, and my three fingers at his mandible, fixing his neck and pushing his mouth down, so I open his mouth without moving his neck. This is used as if I see a suspected spinal injury of his neck. The other method we use during making the airway method, as you see in the picture, is using the head tilt chin lift method, and also listening by his ear to the air coming out of his mouth to make sure that there's breathing or air coming in or out. He's feeling the air on his checks by his mouth, and he is looking at the stomach or the chest of the patient laying as it goes up and down. So he makes sure that the patient is breathing well. So as I recap fast, that's airway, doing the head tilt chin lift method, or jaw thrust if I have a suspected spinal injury. At the same time, I'm using look, listen, feel, look at the chest or stomach going up, listening the air and feeling it on my cheek. Then we'll go to the circulation to make sure that the patient heart didn't stop of working. We can check the circulation by two methods. It's the easiest. The radial artery at the thumb, you can all feel it. Lateral the hand, beneath your thumb, you can put 2 fingers or 3 fingers and like compress lightly, so we can feel the pulse here. Some patients have the radial artery weak, so we can use another one or the strongest artery to feel. This is the carotid artery, as we see here in this picture. At the thyroid gland here, on the lateral, right or left, it doesn't matter. You'll find it in both places. You just compress and you will feel the carotid artery. So if you didn't feel in the radial, it's possible, so you can feel it in the carotid. The carotid is the final situation to see if there's a pulse or not. If there's not pulse, we will talk about later about basic life support and giving CPR. Third thing, after airway, breathing, circulation, we'll go to the disability. Disability can be physical, like a trauma, like if he has fracture, he has wounds, he has anything physically trauma, or mentally, by seeking, if anyone writing anything in the chat, I will check it after I finish this topic, okay? Mentally, so I can see if he is conscious, semi-conscious, unconscious, or arrested or collapsed. So we're gonna ask the patient an obvious question. What's your name? Where are we now? What's the time of the day? So we can see if he's conscious, he will full reply with a clear sound. If he's semi-conscious, you can see that his voice is not very clear. He like be coughing and speaking like in struggle. If he's unconscious, the difference between unconscious and arrested, that if he didn't reply, we will use to stimulate pain head by like moving his ear so he can feel pain, so he can talk or make any movement. We can give like a hit on the forearm like this, forehead, sorry. If he didn't reply to any of this pain, so he's unconscious. So I will go to 2 methods. I will check his circulation and breathing again. If it stopped, then he's called arrested or collapsed. In this situation, we will go for CPR. If he is unconscious, but there's breathing and circulation, we will go to a specific movement. We will talk about the next slide. Then the E of the caring system is exposure, to see where is the spot of the fracture, where's the wound, where is the burn, whatever that physical trauma, where it is. So here's a recap. If the patient is conscious, he will give me a clear reply, like what I said, what's your name, what is the time, where are we now, anything. Semi-conscious, he will reply, sorry, but his voice will be struggling or coughing or anything. He is semi-conscious. Unconscious, so I'll make a pain stimulus, as I said, at the forehead or the ear pin. If no, then I will check the circulation and the breathing again. The recovery position, what I said, if he was unconscious and I found that he has circulation and breathing, at first, I will sit beside the laying patient. As you see, like I'll move my mouse. I will move the arm that's far from me, okay? I will raise it up his head, as you see in the second one, above his head. Then the arm close to me here, I will put it across the cheek, down here to the neck, as you see in the video. Then I will grab the closed knee and raise it up. Then I will roll the patient to the opposite side where I stand. So if the patient has a poison or he's gonna vomit or anything, he doesn't vomit on me, but on the ground far from me. This recovery position helps the patient if he has anything poisonous to vomit, if the patient help in the circulation to move better. That is actually done after I do the breathing and opening his airway system. Okay, clear? Then how to do CPR, as I told you, it uses a mannequin or something. So I try to bring you a video that helps you to see. At the beginning of the video, see that the doctor doing the CPR will do the steps we did before. So please concentrate in it. Start it.
Omar, can you increase the voice of the video, please? It's not audible.
To the max. I will send you the video in the group after the webinar. You can't hear anything?
Actually, it's like not very much audible, but it's okay.
Okay, I'll discuss during the video. As you see in this picture, she used her weak hand above the chest and the strong hand above the weak hand. So the weak is below and the strong is above. She will start by doing 30 compression. After it, she will give 2 breathing through the mouth. To produce or reduce the infection, we preferable to use any cotton material or tissue or something, put it on the mouth so I can give the breathing. Let's see what she will do. As you saw here, she made sure that his elbows is straight, not and locked down. She doesn't, as you see here, the arm is very straight. She doesn't lock her elbow. So I put all my strength, everything in my strong arm that is above the weak hand, and then she compressed. Just to make sure that the chest like refill, then I push again. Okay. This method is used for adults. If the CPR is for a child, we use only the strong hand, just one hand, it is the strongest. If it's a baby, we use only 2 fingers and just slightly, so it doesn't break his ribs. I will send you the video in the WhatsApp group after the webinar. So anyone have any questions here? Okay, no questions then? If suspected trauma, how should we perform CPR? What do you mean with suspected trauma?
Like we have to turn the patient to the right side, for example, you said, but if we have suspected cervical trauma, how we have to turn the patient. Like you said, we have to bend the knee and then turn the patient, but what if he or she has the trauma?
in case he has any trauma like in the cervical or spine or anything, we don't perform this method. But at least he's like he's conscious or unconscious, but it's okay. Don't let him vomit now. At the emergency room, they can like clean his gastritis and anything. Any poison will be released at the hospital. Everything's okay. Okay, let's go on to the poisoning. It will be simple next. Okay, poison can be by many methods. The most common two is the person can inhale the poison by the air, or he can swallow it in food or drink or whatever. The inhaled is most common by the monocarbon oxide. It's the most dangerous gas in the atmosphere, that it can cause the patient that his RBCs can release the oxygen and attach to the monoxide and make him poison. So how and what is the symptoms of the carbon monoxide poisoning? Headaches and nausea, dizziness and breathless. As I said, it can attach to the RBCs, so it makes problem in supporting the lungs with blood, and collapse and loss of consciousness at the end. One more symptoms not here, and is the most common, that it can cause cyanosis to the person, that you can know from his skin color. The skin color will be blue or maybe dark blue. At the end, he may be dark. Okay. So what's my first aid? What to do if I saw a person with monoxide poisoning? First of all, if the person is conscious, so I can take him in fresh air. If he's not conscious, so I still have to take him in fresh air and away from the place and the site of toxin. Number two is called 103. It's the basic thing in any first aid method. Number three, that I will check the breathing and circulation as we did in the care system above. If the person is breathing is not available and circulation is cut, so we'll apply the CPR and recovery position if it's sure that not any cervical or trauma, as you said. Okay. Number two of the poisoning is the oral poisoning by food or swallowing the poison in the alimentary canal. As you see, the symptoms are like common to the other: nausea and abdominal pain, vomiting. Diarrhea is new symptom here because it's in the alimentary canal. Fever, headache, and overall. So if the patient with like oral poisoning, first of all, we will fix the patent airway like we do ABC of the first aid. Number two, I put in the questionnaire because it's different from guideline to another. The milk. Like I saw your answers before starting, so like 50-50 drink milk or not. So if anyone make yes for the milk, do anyone know the like the scientific reason for drinking milk? Okay. Milk in its structure, some guidelines say that it's benefit to the stomach, that the milk can cover like the wall of the stomach. So it protects the mucus from getting irritation by the poison. So it helps in the prophylaxis for the toxin to attach to the gastric mucus and cause pain. But if I used many milk, that will cause to vomit the toxin, and the toxin may be like irritating for the pharynx and all the alimentary canal. So it's not preferable to make the patient vomit the toxic like it was SO4 or something. Dilution of poison. As you see, I wrote it below, don't neutralize the toxin. Like the basic of the chemistry, if I took acid, then I drink alkali, then I will cause salt and water. So I mix salt here. The salt may be toxic or maybe make more irritation in the intestine or the gastric. so I can't dilute or neutralize the poison with anything. I don't prefer to make salt in my stomach. Activated charcoal. That tablet many guidelines wrote about, but I actually don't prefer it. Like milk is better that it will prophylaxis the toxin till the ambulance come. It's emergency situation, so it's okay. Lactose intolerance. Sure, if the patient have lactose or any allergic reaction to anything of any tablet, any food, he won't apply the milk. But if not, then milk is preferable. At least it will prophylaxis, as I said, the toxin till the ambulance reaches the site of the patient. Anything else?
Like it's an emergency situation, and I guess in this case, maybe you can check
Or
the
allergic reaction, yeah.
lactose intolerance. That's why maybe milk can be given in this situation.
Yes. Okay, let's continue. Any questions about poisoning else?
Actually, I have one. Like this poisoning is depending on the type, like metal poisoning or which poisoning. Like all kinds of poisoning can be treated with milk.
The oral poisons.
Oral.
Any oral poison. Like if I took SO4 sulfur, it burns the pharynx or burns the mucus. So I will drink milk, so I protect the mucus from being irritating by the sulfur. If I took any alkali, anything that interacts, it will prophylax anything from irritating the mucus of the stomach.
Alcohol poisoning also, right? Oh.
Yeah. But in case of inhaled poisoning, no, we don't need to take milk. It's about the lung, not the stomach. Yogurt for food poisoning. Yogurt's made of milk, so yes. Okay, as we see, this poison is about the scorpion sting. It's like kind of common in desert places or something. Actually, the venom or snake poison may be treated in the same way. So the symptoms of the sting, how to know, even it's so basic, the history from the patient. If he was conscious, he will tell you that he was stung by a scorpion. So the symptoms of the patient, he will have pain, like burning feel like, but he's actually not burned. He won't feel his extremities like fingers or toes, and late or advanced symptoms that he will be in convulsions and maybe blurry vision, he won't see you clearly, and he may be unconscious. So what to do? First of all, if it's available, to wash with soap and water, or I can use any water without soap. Then I will use a tourniquet, or if it's not available for sure for anyone, we can use like clothes, we can use anything to like attach it and make the toxin like localized in the place. I will make an example. If I was stung here, okay, then I will make the tourniquet at this situation, at here, this site, so the blood can't return, okay? This will happen to the venous blood, not the arterial. The arterial stopped here, okay? Then I will wash the stung by sodium permanganate to oxidize the toxin at this level. Clear? Then I will, like recap, I will tourniquet here at this site. So the toxin is here. It won't be able to go back to the heart. Then I will make sodium permanganate at the site, so it oxidizes and washes the toxin away. Till this time, I won't release the tourniquet till the ambulance comes back. Some people will tell me that the tourniquet can cause gangrene and death to the living tissues at the front. Yes, it's very correct. But if it's gangrene, so it's possible than being dead from the toxin of the scorpion. Because if the toxin went to the heart, then he may actually go through unconscious and die of shock of the respiratory failure. So I prefer if it's gangrene, so it's better than the toxic to be released. Herbal plants treat food poisoning. Some people say that men can treat food poison, but actually I read too many guidelines like no one told about the herbal plants. So maybe it has effects in ingestion or absorption, but it doesn't affect poison. I read about it too many. Clear. Okay. Okay, this is like a game, it's like interaction. So I hope that you all answer in the chat. Like it's about the myth. It's very, very known in our. You said sodium permanganate, yes. This information is very traditional in the communities. So let's go through it. First one, that we should use ice to on the burn directly to treat it. Is it true or false? How long do I keep the tourniquet? Tourniquet will be held till the ambulance reach you. False. Okay, as you said, it's really false. Yes, it can make another burn. First, you must clean with water. Actually, Gulner, we won't use ice any time, even if we cleaned the burn with water, because as someone said above that the ice can cause something called frostbite. It's another type of burns like freeze. It will make your skin look like light blue color, and it's very painful to use or apply the ice directly on my skin. So it's preferable to put the ice on like a cloth or any something and put it then on the burn, but it's not used even to use ice on burn. We will talk about it later. Secondary trauma, exactly. Okay, got it. Yes. Okay, let's go to the second question. Toothpaste has a treatable effect on burns. It's right or false? Right. False. No, it actually doesn't depend on the kind of the toothpaste. I know this is very known in the communities, but it's actually false. And it doesn't help the sunburns. It's like because it's cool and your sunburn is like warm, so you feel that you're getting better, but it's not helping in anything actually. Some kinds of toothpaste. Actually, their chemical structure is all like, even if it includes mint or something, as I said, it just cools your warmness, not affecting something. Yogurts? No, no way, trust me. Look, everything you all said is like about being cool and putting it on your burn because you feel like hot on your burn, but you're just feeling cool, not more. We use yogurt for everything. No, actually, guys, don't use yogurt, please. Like, seek for any creams. Trust me, Egypt, they use the same method, but they use anything, not also yogurt. Is it helpful, like what's in other words, like anti-inflammatory? And actually, it's anti-inflammatory, but not in all cases. Like, I have sunburn. It doesn't include any inflammation in a sunburn. It's not painkiller, I said. It's just making you feel cooler, not more. Yeah, egg. Some people use eggs. Okay, then the last one. Can we use honey then? Honey on the burn, or wands. Some people put it on the bleeding. Potato. Okay, then IFMSA-Egypt uses honey and IFMSA-Azerbaijan uses yogurt. Makes sense. Okay, actually, guys, some people say that honey has anti-inflammatory effect. Some studies prove it, but actually, it's not preferable to use it. We don't use honey, neither yogurt, neither something. We will talk about the creams that's used. For burns, it's preferable to use oils and ointments that prefer or include herbs like sesame, syrup, and other herbs. Neither yogurt, neither yogurt. Okay, let's discuss. Let's discuss. I know that burns have many myths. Someone raised his hand, so you can talk.
Gülsüm Imanova, you have raised your hand if you have question. Gülsüm, el kaldırmışsınız. Sualınız varsa diyebilirsiniz. I guess it's mistakenly.
Maybe. Okay. Okay. Then all we said is myth, not true. So look, burns have 3 degrees. Some guidelines say that they are 4 degrees, but actually the third and the fourth has the same first aid and the same situation. So it's considered at a 3-degree burns. Okay, the first one is the superficial burn. Actually, we all have been through it, like touching any hot thing, like a hot pot, hot anything. It will be the superficial skin, won't go deep. It actually like make redness, and it is very painful because as we all know that the superficial skin area has the more nervous sensory of the human body. The second degree, some of us also went through it. The second degree is specific for like forming of bubbles or like blisters on your skin. It's very common to know it's the second degree or not. Also, there's another method to know if you don't have blister and you want to make sure that you are the first degree burn. You can like press on your burn for like 1 minute, then you release your hand, you'll see like a blushing. If there's blushing, then your first degree. If not, then it's second degree. But if you have any blister, don't press on it so you can't pop it and you will make release of inflammation on your skin. The third degree, it's like the most dangerous one. It's like reaching the fat and the muscle or the bone of your body. Actually, as you see, it's the most serious, but the less painful because all your nerve sensory was burnt already, so you won't feel anything of your fat place. Is there any proof about oil's contribution to healing process? Oil? Guidelines doesn't cover any oils or something not chemical. The only thing natural that can be used to treat burns is like using herbs, as I said, sesame or coconut oil, yes, because it's natural. Coconut oil, sesame syrup, and many mixtures can be in a natural or chemical cream. Actually, I don't know about Azerbaijan's natural creams, but if one in IFMSA-Egypt want to know, it's Mibu cream called. I don't know, it's franchise or something. What is the best treating way for the third degree? Okay, I'm gonna talk about them yet. The first aid of the third degree is all I can do, that I will relieve any cloth around the space so it doesn't get attached inside my body. Any jewelry, I will remove it. Then I will cover the patient in a blanket or anything and go immediately to the emergency. He will apply any surgery at once. Okay. Azerbaijan national cream is yogurt for healing. You guys have wrong understandable for yogurt. Just use it in poison situation, not more. And food. Okay, as we see here, this is a histology slide, maybe more. The first degree actually at the just joke, sorry, it's okay. The first layer of the skin, the epidermis. This is the painful type of burn, and it doesn't form any bubbles or blisters here. The second degree burn actually reaches the derms here. It's like form bubbles and bullae or blisters, as I said here. And the third degree reaches the hypoderms that include the fat in the skin layer, and it may reaches the muscle and bone in some situations. Okay. As I said, this is like more accurate. The superficial here, as you see, no forming bubbles. The second one has blisters and bullae here. And the full doesn't have anything, just like the skin was worn out or something. As you see, it's very black. You can see the bone if it reaches to it. It's very stressful to see it. The superficial one is the most painful. No edema, just blanches, as I said, when you press on it. The second one is the one painful also, and have some blisters and bubbles that you don't have to pop it. And the third one, immediately take him to the hospital. So as you see here, this is like the first 8 of the stages. First stage is the superficial one, just to use cool water or like the water from the tap of the bathroom. Make it for 10 minutes on the surface of the burn. The second degree here, we use the water at the first for 10 minutes. Then we use the cream or the ointment or any medication used for burn, except yogurt. And we can like make a bandage around it that if he was a child or someone, so he can pop up the blister or the bullae. The third situation here, the third stage, and the fourth stage, the same one. We talked about that we will reach the bone or muscle. So I will relieve any clothes or jewelry and take the patient immediately at the hospital. So the burns is clear.
Also, I guess that it's like essential to emphasize that don't use the compressive gauze, because it can damage your skin when we extract it in the hospital. Like we can just put a gauze, right?
Right, I guess, or a bandage.
But not compressive.
This is at the second one, not the first. Yes. Anyone have any question about burns, or is it clear? What was your stage, Layla? First or second degree, third degree? I guess this was the first. The bandage can we be with painkillers, but in the second situation, not the first. Layla, the second degree, because the like the bruise or the blister started formation after the burn. It takes time, so you just felt the pain of the like your skin was stretching above to form the bruise or the bullae. Anytime. Any other questions? So this is the recap of the situation. We won't use toothpaste, neither ice, neither honey. Actually, I have to add yogurt here. Is there treating way instead of surgery for the third degree? Like it's more advanced for the plastic surgery or the plastic specialist, so I'm not aware of it. But as first aid, we don't have nothing to do except like release his clothes and jewelry and cover him, take him to the emergency. After the emergency, it's up to clinical or emergency medicine. And it also depends if the third degree reaches the bone or reaches the muscle or anything. Actually, the surgery that's performed in this situation, that he may make like called a wolf surgery. He takes a piece of skin from a current or site, like the hips or something, and he places it at the site of the third-degree burn. It's called a warp plastic surgery. Okay, so let's go to the bleeding. The first one is the epistaxis. Epistaxis means that release of blood from my nose, and the internal bleeding and external bleeding. This is cuts or wounds. So let's go through it. Epistaxis. Before going to the, I will hear from you the wrong community information. What to do if you have a release of blood from your nose? Would I go backwards or frontwards? Spoiler alert. Front. Okay, guys, you saw the photo, right? Front. Okay. So anyone know why won't I go backwards? We know that. Okay. Thank God. Clear. Okay, going backwards, may the blood return to the pharynx or to the larynx. That I will make like infraction here, so I will die, obviously. Many people say that you have to go backwards. Yes, the blood will go through the airway. Many people say to go backwards so that you can see the blood, but actually I want to see the blood because this is more safe for me, that the blood is out my body, not inside my airway. We don't use ice actually. We just compress the soft tissue of my ear here, of my nose, sorry. We don't use ice. Ice is used as an anti-inflammatory. We don't have any inflammation here, just have like gush of blood from your nose. It's like, it didn't help, trust me. Just feel relieved, but actually no guidelines say it. You must not use ice for bleeding and burning. Exactly. Actually, if I applied ice on the same situation, I will cause a frostbite. Actually, it's the same. Your vessels in the nose is very small. It's not to use ice. If I used ice, I would make like a frostbite or something. It's a type of burns that will be painful. So I made second trauma, and I didn't get anything. Okay, any more questions here? I'm sorry if there is a background sound like a storm outside. So I'm sorry if there any disruption. Okay, so epistaxis, as we said, we will go frontwards and compress the soft tissue of my nose for like 10 minutes. If after 10 minutes, if there's like a gush of blood again, then I will apply another 10 minutes. If it's just continuous, so I have to go to the emergency of the hospital, and it will go to the ENT specialist. If the person have hemophilia in normal, it's normal to find like your blood is more than a normal person, because hemophilia, as you know, it make increase of the blood during wounds and any bleeding. Okay, for the internal bleeding, the symptoms to know that you have internal situation is like you feel like weak, some drowsy or something. You will like have a slightly bad vision, and your breath will be affected. Chest and shoulder pain, and as you said, hands or feet is weak, nausea and vomiting and pain. But if you concentrated on this photo, we can see that this symptoms is similar to the inhaled poison. So in this situation, the only something that can know if it's poison or internal bleeding, the color of the skin, as I said. The person who has poison will have cyanosis or like blue color. The internal bleeding person won't have it unless if the internal bleeding is localized in a certain place, you will see the red color of the like the burn. You'll see it like the burn. The red color of the burn, you'll see it again, but like deep in the tissues. The first aid of the internal bleeding, that the person have to go to the ambulance, call the ambulance, go to the emergency. The person will go through several ways of ECG and advanced first aid basics in the emergency room. Okay. At for external wounds, this is like everything about the wounds in one slide: when to call the ambulance, when to call a doctor, and the basic of any small cut or something. Apply a pressure just to stop the bleeding. Second thing, raise the limb above the heart. Like if I have the wound here, so I will raise my hand above, so the gravity will push the blood down, so I can't bleed more. It will reduce the blood. Third thing, if I stopped the bleeding and removed the pressure of the clean towel, I can clear all the surrounding blood of any inflammation or anything. Use antibiotic cream or not yogurt again. And protect the apply bandage or gauze or something, so I can really relieve and reduce the inflammation of the wound, and cover with a sterile bandage. So if the person have these things, I can do it basically or simply at the site or at the home. But when should I call 911 or 103 as Azerbaijan ambulance? If the bleeding was severe, in case of the person have hemophilia, abdominal or chest pain, or the blood was very, very dropped out, because this may be two situations. It's the cut in the artery or the vein. And bleeding, if I put the towel on the bleeding and it didn't stop after like 10 minutes, then I released the towel and found blood still dropping, then I have to call the ambulance in this situation also. Then I call a doctor. It's the same situation when I call the 911, even in this, so I call 911 in the second row and the third row, not the second only. Here also we can call the ambulance. If the wound was deep, because if the wound was deep, the blood will be very, very released. So these both are connected, okay? Signs of infection, as I said, if there is any infection or parasitic infection, we can call the ambulance. If the wound is on the face, we have to immediately seek a doctor because if there is any plastic surgery will be applied for the patient. If there's any dirt come out like pus or abscess, anything released from with the blood, this means there's a parasitic infection here. Or an animal bite like dog bites, you know, you have to take many injections for it. There's many questions. Stomach area. Okay, if you have stomach specific, if you're talking about inside the stomach, you will vomit blood. It will be like you will notice it. When you vomit, you'll see blood in the vomits. This means you have an ulcer. It's not called about bleeding. It's an ulcer mostly. Sometimes people use iodine. Iodine is used as not in the epistaxis. It's used for treatment of wound. If I want to disinfect the wound, but not in the epistaxis, I want 111. Actually, I don't know the SOS in Azerbaijan. I only know the ambulance number. I guess 102, the emergency.
Like 112 is for all emergency situations, like for earthquakes, for police, for firefighters, like all the emergency cases in country, but especially for the ambulance, it's 103.
Oh. Okay, any more questions? Okay, then clear. Okay, we will go through fractures. The fractures, the symptoms to know if the person has fractures or not. I don't understand after yogurt, but don't use yogurt again. Okay, for fractures, we can define fractures and know it from bruising on the skin, swelling, deformity. If like you'll see the hand, if the fracture is in the hand, you can see the deformity in the hand. It's not like natural hand. Okay. As I said, I discussed wound before fractures because fractures can be associated with wounds. As you see, this is the closed fracture. It's localized. The fracture didn't move away from the bone. It's just like a hit here. But in the open fracture, the bone can move from its place or the side and make injury to the surrounding structure. The bone may be seen outside the person or the site of fracture. In this case, we're gonna treat or first aid basic for the wound first, then I will go through the fracture. So I have to stop the bleeding first. And if the patient, the ambulance arrived, for your knowledge, the emergency will deal with him as a cardiologist first, stop the bleeding, then they will fix the muscle, the bone at any time. Okay, as we see here, the person called the ambulance at the first, and it's necessary not to move the patient from his side and do not apply massage for the fractured patient. It will move the bone. It may be hurt him more. It may damage surrounding structures. I will won't gain any benefit from this movement. Number two, make exposure if there are any trauma in the body except the fracture. Number three, how to make a splint. I will send you like videos because the video voice will be like clear here, so I'll send you how to make it. But the basic, any site have a fracture, we have to stabilize it by fixing it to a hard substance like a stick, fixing his arm to his trunk. If he has a fracture in his leg, we can fix his other leg to the fractured leg, or I can use a piece of wood or something and attach it around his structure. Here we can use ice, but not direct, direct application for the ice, but we pack the ice in any cloth or anything. So we put it around the fracture to reduce the swallowing in the patient, but not direct application, as I said, because you will make a frostbite. So here is the only situation that I used ice to reduce the swallowing, not inflammation, okay? We use it for swallowing, not inflammation. Okay, for epilepsy and convulsions, we can't help here the patient or with just a little things. Even for immunization, we can use patient's clothes. We can use the clothes, but I still need a hard substance to attach him through. Like if I have a fracture in my hand, I need to bring a wooden substance or something, then I attach the arm through it. If I have a fracture in my finger here, so I will bring like my mobile, a hard substance, and put it like this, then like surround it with the substance. So it's like this, okay? For convulsions, we can't help the person like 100% because it's like neuro specialist. So if the person have convulsions, I can't stop him from moving. Just leave him move as he like till his convulsion is end. But all I can do if he's wearing a glasses, so I can release the glass. If he has like loose the tight clothing like here, so he can breathe well. Turn him on a side if he stopped convulsions. Don't put anything in his mouth because he may swallow because he doesn't feel anything. He's just like in a convulsion. Look for the disorder or his history. Call his family or call the ambulance in the case of the convulsion was severe, and try to offer psychological first aid and mental health support for the patient. Tell him that everything is fine and he is fine, everything, so he can't panic and go through another convulsion. This is all we can do for a person going through any convulsion situation. The advanced all in the hospital, as I said, for neuro specialists. Putting spoon in mouth, he may swallow it, he may like go in a obstruction in the airway, and he will go through a respiratory failure in this way, so it's very, very wrong to do it.
Unfortunately, it's also one of the major mistakes that's done in Azerbaijan. Of course, not by doctors, but by normal population. When they don't know or they are in panic, they can like put the spoon or something in mouth and trying to relieve. They think that they will relieve, but it's actually the major mistake that is done in epilepsy.
It's very wrong to do anything in his mouth. Turn on side, which side? I'm asking for the heart. It won't affect the pump of the blood or the heart situation. You're just making him like rest, nothing more. Spoon also finger. He will bite your finger. I don't care. He will. Okay, for the last thing for our basic session today is how to deal with the allergic reaction. We all have allergic to any food. No pain, no gain, and no yogurt. And no spoons. People said tongue can go back, therefore they use spoon, but said not finger. This person can do. Okay, in this situation, if the person can swallow his tongue, you can notice if he will cough or sneeze or anything, you will notice that he has a difficulty in breathing. So you can apply, as we said at the beginning, head tilted chin left method. So you can open his airway, so he won't swallow his tongue in this case. But we won't use a spoon or finger. Anytime. Any more questions?
Actually, I have a question.
Yes.
We knew that epileptic status is the worst scenario during the seizures. Let's assume the patient has developed epileptic status. We are observing a paralysis on the muscles. What can we do? Like we see this patient feels some problem on breathing, just the paralysis. And
Okay, if the
and
patient
the
is
ambulance
going,
coming.
if the patient is going through severe convulsion, he doesn't control his muscles or any movement. So you have to finish him to make him finish his movement and the convulsion. Then you can touch him, because you're like he's not controlling his arm. So maybe if you're fixing his muscles that he's moving, you may like complications for the convulsions, or he may harm himself. As I said, for breathing, you can apply the airway and breathing situation to open his airway, like head tilted chin left or jaw thrust. But in this case, you use head tilted chin left because he doesn't have any spinal injury. That's all you can do for the convulsion patient. Till the ambulance come if it's severe convulsion. That's all.
Thank you.
And also, I have one question. For example, we know that the syncope can mimic the seizure symptoms. And we know that syncope can be associated with the hypoglycemic states, for example, in let's say the diabetes patient, after, for example, when he's angry, he felt suddenly, I guess I wanted to say that it mimics the symptoms of the seizure, how we can differentiate it.
Okay, if the person is hyperglycemic, he won't go through seizures. He will go through a diabetic coma. If the person is going through a diabetic coma, you can't know if he's hyper or hypo. So there's like a term very known, it's like whatever the cause, give glucose. This is like a term used. If he is hypoglycemic, then he will actually take the glucose, so he's better now. If the person is hyperglycemic, he will actually like get out his coma, but he's actually going through a severe hyperglycemia. But in this case, you will know if he's hyperglycemic, so you will go through giving him insulin or something, but you are getting off the diabetic coma. If the person is actually, that's why we don't use spoons. Like him, actually, if he used the spoon, let's look at the complication. If the person went to another severe seizure on convulsion, then he may bite the spoon and make any bleeding on another complication is mouth. So the spoon is not the best solution for this seizure. Any more questions? Oh, okay. Then let's go to the last topic of our first aid session. It's allergic reaction. We all know that allergy can come from food, can come from parasite, can come from animals, dust. So the allergy is like we see here: red eyes, runny nose again, rash, and he may tear if it's severe, and sneeze. The factors, as we said, is maybe food, pollen of the flowers, animals. Cat is very common for this allergic, and insects, and food, as I said, and dust. So all I can do for the allergic patients, call the ambulance, because it's very internal medicine situation that he will be treated in the emergency room. If it's available, to give him an epinephrine shot to control the components of the allergy, and let the patient lay on his back for like 1 or 2 minutes, then put him in the recovery position as we mentioned above, because he may like vomit the food or something that caused the allergic reaction. And if he has a tight cloth, then remove it so he can breathe dose of epinephrine. Yes. Lose the cloth so he can breathe well. The auto-injector of the epinephrine is like a specific dose. You can take it from the pharmacy, tell him that you want an epinephrine auto-injector. It's like the insulin, it's just like fulfilled, automated. It's like a pen, as you see in the photo. Any other questions? Cortisol, it will depend on the type of the allergic reaction, and we can't specific it in the first aid situation, but in the internal specialist or in the emergency room, he will decide what the type of of medication that the patient will take. If you want my experience, cortisol is taken in pneumonic patients or like asthmatic bronchitis or something.
Yeah, even in asthma, we use the beta mimetics for short relief. First of all, cortisol for the next cases like dexamethasone, beclomethasone.
Okay, any other questions? Okay, so we're done with our first aid session. So if you have any question, you can write in the chat on above anything except yogurt, please. Okay, we're done, pandas. Okay, we'll have like 2 minutes or something. If anyone have any question about anything, can you explain D and E? Okay. E is the exposure of the body, so I can see if there any physical trauma, not more. This is the exposure. Expose the patient to check about any trauma, like any fracture, to see if there is deformity, if any place or any site, if there is any wounds, any bleedings or something. The D is disability. Disability contains two methods, physical or mentally. Physical, that is there any trauma? This is the disability. And another disability is mentally, that I ask the patient in the emergency situation, what's your name, what's the time, where are we now, anything. If the patient's reply very clear, then he's conscious. If he like replied semi-conscious, like he's like a sluggle and hard in speech, this is semi-conscious. He's like in a shock, not more. Unconscious and arrested are the same thing, but the unconscious patient have circulation and breathing, but it's just in unconscious situation. But the arrested or collapsed patient doesn't have circulation, neither breathing. Thank you for explanation. You're welcome. Any more questions? Okay, I will send you the post questionnaire evaluation for the session on the group, and I will send you the video and videos for how to apply a splint of the arm and a leg. If anyone's need anything, I'm with you in the chat. You have my number. You can ask me anytime.
Actually, if it is available for you, we can take a photo, and I will request for all of you to just open your camera and we can take a Zoom photo for memory. Is it available for everyone? Do you want to open your cameras or guys? I guess that nobody wants to open camera. Şekil çektirme için kameranızı açabilirsiniz. Can you take photo, Omar? Because my computer, I have problem.
Yeah, sure. Give me a second. They are not all in the same place. Like there's some 2 pages. You have the same problem, right?
Yeah, I have the same problem also. Okay, take anyway. We can send them.
We can take it double.
Yeah, sure.
Yes. Okay, cheese. Okay. And the other group, they actually are, their cameras all off.
Guys, can you open the camera just for a minute? Millet kameramızı açabilirsiniz.
Okay, just okay, smile. Done. Okay, it's done.
Thank you very much. Send it please to me, or you can also send it to group.
Okay.
So if anybody has questions, please don't hesitate to ask. We will also send the presentation to the group and post-evaluation questionnaire, and please fill it. I want to thank Omar especially for accepting our invitation once again. Thank you very much, really. Yes, even exam, and I wrote it in exam period, and he accepted our invitation. Thanks to him especially for this presentation. I hope that we will also meet in another collaborations, the IFMSA-Egypt and IFMSA-Azerbaijan, AzerMDS. So thank you very much. And guys, if you don't have question, we can close if you want, if you don't have any words. Yogurt drama. In chat, all the comments are about yogurt almost. I guess we can close because there is no question, it seems.
Okay. Bye.
Bye. Thank you all participants. Bye.